Hello, folks. Welcome to another edition of Inside the Marble Palace. I'm Murray Mandrick, political columnist for the Regina Leader-Post. By the looks of it, only one of us is inside the Marble Palace. No one's inside the Marble Palace technically right now. This is Steph Taylor from Canadian Press and Arthur White-Crumbie from the Leader-Post coming to you at home. We are inside the Marble Palace because the legislature is back sitting. And obviously, we're starting with a throw-in speech. And the issues in play are COVID and pretty much everything that went on in the election. Arthur, just give us a quick recap as to what was in the throw-in speech on Monday, what the new session kind of will look like in terms of the government's agenda, because throw-in speeches are all about the government setting the agenda.
Yeah, the throne speech really contained very few surprises, Murray. It was just basically rehashing the Sask Party's election platform, and I think that you said it best in your column that it seemed kind of incongruous to go from Russ Marassi's statement there that COVID-19 is the #1 priority to a statement about the SaskPower rebate, which the government seemed extremely excited about yesterday. I think Steph was the one that noted that they sent out a tweet right away saying promise made, promise kept. So they're still in election mode, but COVID has definitely completely changed the game. And it didn't seem like there was very much in the throne speech to take account of the new reality. With more than 260 cases on average per day right now. And the NDP was really quick to point that out yesterday. So maybe we can dissect how that went as well.
We'll get into that a bit more in a moment, but I'm going to bring Steph in here because I thought you did just a brilliant story comparing the throw-in speech to every other statement that the government has made lately, including the April 22nd Open Up Saskatchewan, Reopen Saskatchewan provincial-wide talk. And you did a great story about how similar they were. Do you think the government, well, tell the folks about exactly how similar it really was, Steph, and can you offer some explanation that you got from government officials as to why there was not that realization that, in essence, that they were just plagiarizing their own work for a few months ago? What was there? Why would they do this?
I mean, I think I noticed it, and maybe this speaks to just how many briefings I've been attending at this point and how much I've heard of the premier speak this year. But as soon as I was reading the throne speech, I was like, I feel like some of these parts are pretty familiar. And so the things, healthcare workers, essential workers, farmers, truckers, business owners, it was in some cases, the phrasing was pretty word for word of what the premier's televised address was back in late April when he announced that some restrictions could be lifting for small businesses. The explanation I got from the premier's office was that this was just another opportunity to thank healthcare workers, and particularly just given the reality that they are in now. I think it's worth noting that on April 22nd, when the premier sat in his office and delivered that speech where he made very similar thank yous, I think at that point Saskatchewan had a total of 326 cases, and the day the throne speech was delivered, we had 325 cases announced that day, just for a bit of a comparison as to where we are. And I mean, it's not like the opposition made much hay of this, and this could have simply been, speech writers just deciding to, feeling like they wanted to make a similar sentiment of thank yous. I don't really know kind of the inner workings there. And certainly it's not like the opposition made a lot of hay of it or the government took too much flack. And I don't want to make it, a mountain out of something that maybe doesn't need
That's
to
my
be.
job.
Yeah. The columnists to put that level of analysis on there. But I just found it noteworthy given the fact that we are in a different situation.
Well, you're being humble. I think it was tremendously noteworthy. And it speaks to what I can speak to that maybe a little bit more easily than a reporter can, which is analyzing where the government mindset seems to be at any particular time. And what this tells me is, I think, as Arthur mentioned right off the top, they still seem to be in election mode, that the past months that you're talking about, Steph, where we've had this explosion COVID-19 cases, where we actually had more cases and more deaths more deaths certainly in November alone than we had in the previous 7 months leading up to it. And this explosion of hospitalizations, which is the real problematic and potentially tragic reality to this, because hospitalizations eventually equate to deaths, because you're being hospitalized and in ICU and placed in ICU for a particular reason. I don't think this bodes particularly well for December. Arthur, what did you hear this week that suggests that the government is taking a different approach, maybe trying to not necessarily downplay the issue, because in fairness, they didn't in the throne speech. They did say it was their number one priority, but to basically change the conversation and the topic to something else that maybe is a little easier for them to handle and digest. Did you sense much of that in both the throne speech and what you've sort of seen since we talked last week? Because I think there are elements that maybe this was just trying to be a conversation changer to the gloom and doom and of the throne speech. And let's talk about our election agenda, which for the next 4 years is obviously something they'd rather talk about and something that's more positive than talking about COVID.
I mean, I think that they're constantly trying to persuade people that there's light at the end of the tunnel, and trying to look past the crisis that we currently find ourselves in. We saw that at a few notable moments over the past few days. One was when Premier Moe brought up the prospect of relaxing some of the restrictions over the Christmas season. That happened twice. Once where he talked about potentially relaxing some of the gathering limits, and once when he even raised the possibility of people being able to visit relatives in long-term care homes potentially for a few days, depending on where cases are, of course. Also bringing up the vaccine again and again. He really likes to talk about the vaccine more than he likes to talk about restrictions, and more than he likes to talk about the caseloads. We heard the government tout its vaccine plan, what they're doing to try to get vaccines to people as quickly as possible. Twice during question period yesterday, when Ryan Miley was trying to press them about current measures to either support businesses or to prop up the healthcare system, which is obviously feeling some really acute pressures right now. Efforts to get a vaccine to people, a vaccine that isn't even approved yet, was really something that the government and the premier felt a little bit more comfortable talking about.
Well, I'm going to bring Steph in here on this, because your writing tends to be more from a Saskatchewan perspective to a national audience. And I think when, in many ways, when the premier speaks about issues like the vaccine and the difficulties, legitimate difficulties in some cases, of dealing with the federal Liberal government and Justin Trudeau, he's speaking more to your audience, a broader audience, than he is locally. Although obviously he wants that message to resonate locally. What is he saying to the rest of the country about the federal government? What is he saying to the province about the federal government? And why do you think his message is resonating or not resonating?
I mean, I think in some ways, Saskatchewan takes some solace in that they are not the only government dealing with COVID-19. And I think it's worth noting, like, Saskatchewan is in really its first actual real wave of COVID-19 in terms of widespread community transmission. So, I mean, Scott Moe was certainly not the only premier to voice concerns about when Canada is going to be getting its vaccine, when Saskatchewan is going to be getting its dosages of it. I mean, one thing I haven't heard locally that I think any premier is going to have to get into the details of is how that distribution system is going to work. Like, is this, how is the SHA going to be preparing for this? What is the ministry doing to lay the local infrastructure groundwork to actually get this in people's bodies, if they so choose to get a vaccine, once they actually have the dosages? Is
it working as a federal is an issue that there's a federal component to what's going on right now and that he can effectively blame the federal government? Or are we in a situation where the problems in Saskatchewan are just so overwhelming right now because of the caseload numbers coming up that message just isn't resonating maybe as much as Scott Moe and the Sask Party want it to resonate from a political tactical standpoint? Do you think that the people are sitting back and saying, yeah, Trudeau's a problem too, we got problems here, but Trudeau's a problem too? Because I think that's one of the reasons why they really want to get that message out.
I mean, other than the Premier saying it kind of once, a bit unexpectedly in a news conference after the federal Conservatives kind of started going after the federal Liberals about the vaccine rollout plan. And I think there are legitimate concerns that Canadians have about when the heck is Canada going to get the vaccine. And I mean, the Saskatchewan government can focus all it wants on when it's going to get those vaccine dosages, but that is not going to stop them from getting questions about what are you doing for the situation today. I think we are at a point in the crisis, Canada-wide, where citizens are informed and they are expecting governments to fill in the blanks a little bit more, and the questions are becoming more pointed, and the specifics, there's more question marks around specifics. For example, when the government says we are balancing priorities like the integrity of the healthcare system with people's mental health and battling the spread of the virus and jobs, I think there's an expectation from the public to get into the details of, like, how are you balancing that? Why are you making the policy decisions that you are making? What does it mean to be able to manage this spread of the virus with the healthcare system? Does managing mean ICUs being full and health officials sounding the alarm that people need to be cutting down on their contacts because in 4 to 6 months, half our acute care beds could be devoted to COVID-19 patients. So these are really, really big questions. And I think since the election, there has been this collective period of uncertainty from people about what the heck is my Christmas going to look like? What's the spread of the virus going to look like? What's my job? How secure is my job? Are we going to see more restrictions? And I think like that generalized sense of anxiety and uncertainty has not gone away. And so talking about what Ottawa is doing is not going to, I think, provide enough cover or, deflate the oxygen from the pressing questions at home.
As long as the numbers keep going up, the numbers are the numbers. And we weren't talking about the numbers as much a month ago because the numbers weren't generally as high. Every day, Arthur, you're wading through two crowds, it seems. You're wading through a crowd in front of the legislature, protesters who tend to be of the variety of the anti-shutdown, anti-mask variety. But you're also wading through on social media and everything else, as we all are, a huge debate over coming from that particular crowd, but also coming from the other crowd, pressuring Moe to do more. A lot of them are medical people, basically, or people with sympathies towards the concerns of the healthcare community, the healthcare providers related to that. And I think that's a real weakness for the government right now in terms of how it looks like it's addressing legitimate concerns of the business communities and others that tend to be in line sometimes with the anti-maskers or the open up the economy types, and the concerns of the medical community. Can you just briefly look at how the government addressed both this week? Because I think the whole opening up Christmas thing was where he was trying to address both issues, and I'm not so sure he was successful. So what did he say in that regard, and how do you think he was trying to address both of his audiences there, Arthur?
Well, first of all, I'm not convinced that those two groups are in any way a primary audience, and I really think that the sweet spot is in the middle. And I think that when we find ourselves as journalists plugged into social media and accosted by some of the louder voices protesting in front of the legislature, we're really getting kind of a funhouse mirror effect. And I really think that the overwhelming majority.
I got a funhouse mirror effect every day, by the way. So.
I really think that a much larger chunk of the population is does find this idea of balance alluring.
Is there a middle ground for him, though, Arthur? Is there really a sweet spot? It's an interesting observation, a great one, I think. But I don't know where the hell it is. I don't know where that ground is, because I hear so much division, even among people that seem relatively reasonable. It ultimately comes down to me, to someone asking the question: do you want the economy open or not, or do you want to be able to go home to see your family for Christmas or not? So I guess what I'm asking you is, can Scott Moe find a middle ground there? That, because I think you're right. I think he's truly trying to, but it doesn't seem to necessarily be satisfying anybody at any particular time.
I mean, clearly we're in a different place now than we were during the election campaign. But I think that the way people reacted to the government's management of COVID during the election campaign, when cases were already mounting, though they were nowhere near where they are now, suggests that a lot of people are comfortable with that approach, with not viewing this as an either or phenomenon, and accepting that in some ways this is beginning to go beyond simply a question of public health. This is a question of our lives. And I think a lot of people are viewing a pandemic with no end in sight, and that's affecting us in almost every aspect, from the economy to our social lives, to our psychology, as something that is now a fundamentally political question.
Well, Steph, you're from Manitoba, as am I, and we both have family there. I find two things fascinating, one of which is they're obviously not taking any lead here in Saskatchewan from what's being done in Manitoba, because they're greatly opposed to many of the tactics the Pallister government is using related to lockdowns, and sometimes for good reason. Sometimes the argument from the medical community is they need to be doing more of the Manitoba model. Two questions, I guess, for you is, why are they not using the Manitoba model at this particular point as a measure of success or failure? Because at this particular point, despite lockdowns, Manitoba's cases aren't going down at all that much, and certainly their deaths aren't going down all that much. And why, on the other hand, are they not taking a look at the Manitoba model and saying what elements of it can possibly work in Saskatchewan, given the relative similarity of the two provinces in many ways?
I mean, at least publicly, Moe has said that we are not in the same position as Manitoba. And so if the government is looking purely at numbers, I think there's an argument to be made that they feel that they are not there yet. And Scott Moe has said as much. Like, Manitoba went into this really stringent lockdown when they were, getting 400. I think they might have even hit 500 cases one day, and that's when these really kind of punishing measures were brought in. And I think if you're looking purely at the numbers, there can be an argument that they're simply not there yet. And I think to the point Arthur was making, like, whether or not people believe they find a middle ground, that does seem to be the approach Scott Moe is taking, of balancing the economy with mental health, with people's jobs, with managing the spread of the virus, with hospital admissions. And there is no indication publicly that the government is diverting from that approach. I think there are still questions from the public about, what is your goal here? What does it mean to bend the curve? How much are you willing to see that curve bend, or how long are you willing to wait while these case numbers continue to rise, or we have a rolling 7-day average that's closer to 300 cases a day versus 200, before you maybe start to bring in more restrictions or expand healthcare more and cancel some elective surgeries. So there's no indication that a Made in Saskatchewan plan isn't that they're going to necessarily be looking to Alberta and Manitoba, but trying to just kind of find a middle ground that pleases people. Having said that, like, the Christmas comments, and Scott Moe acknowledged them yesterday, that he's clearly heard from people about them kind of since he was first asked. I think if something like that is proposed, the government's going to have a challenge as to all of the public health advice it has provided up until this point. That sure, there are lots of people that want to be able to gather for holidays, but remember, I mean, during Easter, I think we were being told to the dangers of basically sitting around a table with our loved ones and sharing the same serving dishes, and how household transmission is one of the main ways COVID is continuing to spread through Saskatchewan. So if the Premier wants to take a balanced approach, there's going to have to be an explanation as to the potential public health implications of something like having, 6+ people in households and maybe being able to give grandma a hug in a long-term care home.
Let's end with that with a quick survey from what you've understanding that the high likelihood is that we're going to see cases increase in December, because we saw them increase in October from September, and certainly from November from October. So given the likelihood of December cases increasing, the likely is Scott Moe, yes or no, going to open up restrictions or lessen, I should say, is he going to lessen restrictions on December 17th when the current restrictions run out, so that we have a more open Christmas? What's your thoughts, Arthur?
Well, I think it's tough to answer because we don't even know how those decisions are being made right now. Like, we got a very convoluted answer when we asked the Premier whether he was going to follow Dr. Shahab's advice. Said that all of those decisions are made collectively. So it's tough to know what Dr. Shahab is going to decide, and whether what Dr. Shahab decides on purely public health grounds is going to become the decision. We don't really know that. Again, it depends on the trajectory in cases, and I am not going to hazard a guess.
Okay, are you going to hazard a guess, Steph?
No, and I don't know. And I think this is the government's approach, is a bit of a wait and see. And, maybe they're collecting feedback from folks about how they feel about Christmas holidays. And again, going to this balanced approach, maybe they make a bit of a trade-off that perhaps I don't know. I don't even want to get into what a potential kind of trade-off is in loosening one restriction and tightening one. But
See, folks, this is the exact problem you have when you deal with reporters. You can't get an opinion out of them. I will give an opinion because it's my job to give. I think absolutely he's going to lessen restrictions by Christmas, and the case numbers rising be damned, because he sure is setting the stage for that. But I guess we'll see. And I guess we'll see next week when we return to Inside the Marble Palace. Stephanie, thank you for joining us. Stephanie Taylor from Canadian Press. And Arthur, thank you as usual. Keep up the fine, great work you're doing. And we'll see you guys next week.
Thanks so much, Murray.
Thanks, Murray.